Well, so much important information in that video and so inspiring to say how we all need to come together to reach our goals and our needs for universal hand hygiene. Um, you know, coming from a global hand washing partnership, we love all Global Hand Washing Day videos, but the thing I love about that video more than anything else is that it ends talking about good hand washing habits, and then you have the smile on that boy's face. And that's really what we're after here. My name is Ron Klemmer, and I'm the Secretariat Director for the Global Hand Washing Partnership. And we facilitate Global Hand Washing Day every year on October the 15th. And we are so pleased to welcome you to this annual event to commemorate and celebrate Global Hand Washing Day, and to talk about the actions that have been going forward and what actions need to take place to get us to that position that every boy, every girl, every person around the world can smile because they have clean hands. And so we'll get right into this. And we will be going through looking at this from a global standpoint and then down to the country standpoint and then to the individual, what we can do. But first, we'll have some opening remarks here. And I'd like to welcome my colleague and friend, Na Nguyen, with USAID to give us our opening remarks. There you go.
Good morning. Thanks, Ron. Good morning, good evening, good afternoon. Thank you for joining us. And happy almost Global Hand Washing Day. I really love that video too, Ron. I thought it was really moving. It's a great job, UNICEF. So in recent years, we've really seen a rise in hand hygiene commitment and action. And when the Global Hand Washing Partnership started hosting this event in 2020, it was during a much different context, right? It was at the height of the COVID-19 pandemic and where hand hygiene saw a surge of interest. However, that certainly was not the beginning of our hand hygiene efforts. The Global Hand Washing Partnership has been around since 2001, and USAID is one of the first members to join these efforts. Hand hygiene has always been a cost-effective but neglected preventive measure. And now we are looking at ways to not only maintain the momentum, but also to sustain the progress that we've made thus far. So achieving universal hand hygiene requires efforts at all levels. We need action at the global level, the national level, and at its simplest, at the individual level. Everyone has a role to play to ensure clean hands ensure that clean hands are within reach. As leaders, as advocates, practitioners, donors, the private sector, and academics. We all have the power to protect the health and well-being for millions around the world by promoting access and practice of hand hygiene. So what do we mean by clean hands are within reach? As we work towards SDG 6, we recognize that rapid progress has been made in recent years, but we actually have to triple our efforts in order to reach universal hand hygiene. So to meet these targets and achieve that, we have to work together to ensure that 100% coverage of hand hygiene facilities across key settings. That includes the home, at institutions, healthcare facilities, workplaces, other public spaces, and community settings. We need a strong enabling environment. We need access to affordable hand hygiene services and evidence-based behavior change programming. And beyond that, we need to look at the system to ensure that clean hands are within reach, ensuring that we have strong leadership, good coordination, clear hand hygiene policies, proper financing, data, and capacity building and innovation. So today, we're going to take stock of the progress that we've been made at the global level, at the national level, and we hope to inspire you to start taking hand hygiene in your everyday life. Thanks.
No, thank you so much for those inspirational words and really setting the stage for where we are and where we need to go. And my next colleague that will be guiding us through what's happening at the global level is Julia Rosenbaum, who's a senior technical advisor with FHI 360. Julia?
Thanks so much, Ron. So as Ron said, this panel that we're going to have for about the next half hour is going to highlight partner commitments and some current efforts at the global level to try and showcase sort of a broad range of global level hand hygiene efforts and to emphasize the importance of global coordination. Could you go to the next slide, please? We're going to have three speakers who you see before you and we'll see in person soon. Joe Estevez Mills, who's technical officer with the Water Sanitation and Hygiene Unit at WHO. Pernil Sarin, who's the director at Lifebuoy Unilever. And the third panelist we have today is Ben Tidwell, who's senior technical advisor with World Vision. So we're going to start out with a broad question, and we can make this as conversational as you can rally. But to all of you, at the start of this webinar, there were some stark statistics presented in the opening video and presentation. So what do you see as some important actions that we can take to really increase our rate of progress for hand hygiene? And Joe, I'll start with you, and we could move through the panelists and feel free again to engage each other. What do you see as some of those actions that we could take at global level to increase the rate of progress? Joe?
Julia, I think I'll just focus on one for now, because I think a lot of other things will come through the discussions. But for me, one of the main challenges that we face with hand hygiene and with really sort of improving across different settings is that it is so cross-cutting, and it really is delivered in an integrated way across a number of different programs. So I think the challenge that arises with that, as I think most of us will know only too well, is this lack of clarity on who should be doing what in which setting. And that lack of clarity can lead to impeded action and can really hamper the best of intentions. So I think at the global level, there's a lot more we can be doing to analyze what happens across different settings, across different contexts, across different countries, to understand how hand hygiene services are being delivered, what functions need to be delivered by which actors, and to really be able to outline that in a way that can be helpful to a government or a country's supporting partner that is keen to do their bit and to understand where they fit within this broader system and how these different systems also interconnect when you're talking about school hand hygiene and household hand hygiene and looking at healthcare hand hygiene, and trying to marry all of those different settings together and have a plan of action that is comprehensive and that is very clear. So for me, a very key issue is around clarity of roles and responsibilities. Back to you.
Thanks, as a key to really facilitating that coordinated action. Thanks so much. Pernil, what would you offer our audience?
Firstly, hello everybody. It's a great privilege to be here as part of the discussion. I think with whatever I have seen and experienced in the last few years, there are three things that stand out for me. One is that it is absolutely, as a private player as well, it is absolutely imperative that any intervention that we do is into existing government infrastructures to give it the kind of scale that it needs. By itself, it will never happen. Secondly, when we are creating programs, we are tailoring them so that they resonate across cultural and demographic contexts. That's when the real insights come out that can unlock big impact. And lastly, that we have to find ways to make our content as engaging and sticky. And this is a marketer speaking, so bear with me. But I strongly believe that that's what helps in some of the interventions that we do to make them stick with the people that we want them to reach. So those were the three that I had on my mind.
Thank you. And I think to much of our audience that marketing or behavior change orientation is nothing at all to excuse or apologize for, because that's just what we are all working towards, is how to figure out how to make it stick, how to not only trigger those changes again, at all levels, that comprehensive approach, but to make it sustained. So thank you for that. Ben, last on this same question, if you could just talk what you see as some of those important actions to take to increase the rate of global progress. Ben?
Sure, thanks, Julia. My role is a bit unique in that I have a research background and a behavior change background, but sit in an implementer. So I get to see a little bit about how this actually plays out on the ground more than some of my my colleagues in academia in the past. And I think really the thing that struck me is, in addition to the behavior change at individual level, so changing consumers' behaviors and household behaviors, I really see the need to think at a higher, sort of higher level in the hierarchy about behavior change. So how do we change the behavior of implementers and governments around this? And one way in particular I see in my work very often is that, the approaches to hand hygiene promotion are often not different than they were 10 or 20 or perhaps 30 years ago in terms of some campaigns, some sort of, people getting on loudspeakers in markets and counting that they've reached this many people with hand hygiene messages, or looking at, relatively low quality hand washing stations that probably are not used, but somehow they're counted in household settings or other places. And I think that, the real challenge, and this is not a new thing for us to acknowledge, is trying to understand how to really to monitor and evaluate these rates of increase. It's not just about people with a place for hand washing. It's not just about people who can identify key times, but trying to figure out how do we really monitor and evaluate these campaigns, because until we've convinced people that their activities are not necessarily leading to the kinds of outcomes we're actually looking for, it's really hard to change the behavior of people. And there's a big disconnect between activities on the ground and sort of global or country level surveys that come, perhaps months or years later, and connecting those two together.
Thanks. That was a lot of highlights in a very condensed space. No, we thank you. I think it's very important, of course, to keep in mind, as you've said, that it's not only sort of changing the behavior out there of individuals, households, communities, but to look at our role as implementers and at government level, and how do we also change the way we're promoting hygiene improvement. So I think that's so key. So thank you for those highlights, among others. We're going to circle back to some of this in the discussion, but turning now sort of individually, back to Joe. The WHO, together with UNICEF and many others, are leading the development of a forthcoming set of global guidelines for hand hygiene in community settings. So why should these guidelines be developed, and really how do you envision that they're going to be used? Joe?
Thanks, Julia. So firstly, in terms of why these guidelines should be developed, I think there are three main points that I wanted to highlight. The first is there are gaps in existing global recommendations on hand hygiene that can really hamper progress in this very important area. So WHO commissioned a review of international guidelines on hand hygiene just last year, which found that across the 51 global guidelines that we found, there was significant disagreement between many of these. So just to provide a few examples, there was inconsistent guidance on the key moments for washing hands. And guidance was also lacking when it comes to the quantity of soap and water required for effective hand washing, or affordable and effective alternatives to soap. And perhaps most importantly, our review found that only 10% of the recommendations in these 51 global guidelines were made supported by evidence. So these inconsistencies were obviously particularly problematic in the context of COVID-19, when governments and supporting partners were working rapidly to fill gaps in access, often without the necessary guidance. So that's the first point. The second is that there is real demand from our member states for such guidance. So, as you'll hear in the next panel, dozens of countries across the world use the COVID-19 pandemic as an incentive to address inadequate access and practice of hand hygiene. And many have since moved away from emergency response models to longer-term development plans, really sustaining the momentum following those gains that were made during COVID. WHO country offices, UNICEF country offices, and many of our other partners in country continue to brief us on government demand for clear guidance to support these efforts. And it's within our mandate to respond to that demand. And the third point on, why develop these guidelines is that it's an excellent time to take stock on what we know and what it means for hand hygiene guidance. So WHO and UNICEF want to bring the best skills, the best science and evidence to inform practice by providing these globally applicable guidelines. The WHO and UNICEF guideline development process involves retrieving and synthesizing the latest evidence and also experiences on hand hygiene, not just from the literature, but from communities of practice. And it's an exciting time to be doing this for hand hygiene. Partly due to the COVID-19 pandemic, in the last 3 years, there's been a significant injection of investment, innovation and learning on hand hygiene. So it feels like an important time to take stock, to review this evidence, to gather insights from those working in the field, many of whom have joined us today, and to ensure that global guidance can be informed by up-to-date evidence and expertise. And we hope that by creating that space and creating opportunities within these communities of practice to consult, to listen, to learn during this guideline development process, that we can use these lessons to strengthen our guidelines, and that we can create a resource that feels that it's co-owned, that it can be promoted and used across WASH and health sectors alike. So 3 things really: gaps in existing guidelines, huge demand from member states still, and a really good time to take stock and understand what it is that we know.
Thanks for such a comprehensive answer, really highlighting the why and how these may be applied. And I think for those who aren't quite so intimately involved in the guideline development process, you've also really highlighted, if you will, both the intensity and the scope of work it requires to develop guidelines that can be applicable globally at various levels within community institutions. So very insightful. Thanks so much. We're going to turn to a partner with Lifebuoy, please, and focus a little bit more on the role of the private sector. So Lifebuoy really has a long-standing hygiene behavior change programming and really sets an example on the role the private sector can play. So could you just speak a bit about some of your global efforts to promote hand hygiene? Sure. I know they're extensive, but if you could speak about some of those efforts and that you're all currently leading. Thanks so much.
Sure. Thank you, Julia. Sure, I would be happy to. And so before I speak about what is our latest campaign and stuff, I just want to speak about the brand itself, because we must understand that the brand Lifebuoy was born with the purpose of saving lives in Victorian England, invented by William Lever back in 1894. So it's sort of been our guiding light to whatever we do. And that's the whole reason we've been so invested in ensuring hand hygiene behavior change reaches the scale in terms of communication that it should. And, since we are today a brand that is the largest selling soap, germ protection soap, you can just imagine the power of this brand. And in terms of being the 6th most chosen FMCG brand, I think it's a huge responsibility for us as Lifebuoy to keep ensuring that we're carrying this torch of ensuring that awareness around hand hygiene behavior change is maintained. And since 2010, there has been completely unwavering commitment towards this. We have reached over 1 billion lives with our behavior change initiatives. At the global level, we were instrumental along with the other partners here in ensuring that the indicator for hand hygiene specifically was made part of SDG 6. The latest campaign that I've been leading, which is super close to my heart, is called the H for Hand Washing campaign. This was the campaign that we launched back in 2020 during the peak of COVID to help accelerate hand washing behavior change by specifically influencing early childhood education. So across textbooks, worksheets, and all educational material, and I can tell you with a 20-month-old daughter, it really pains that the only way the letter H is taught is by, saying H is for hat or horse. So we want to say that H should not only stand for hat or horse or hippo, H must stand for hand washing. The simple intention, frankly, is to integrate hand hygiene into the school curriculum. And since the launch in 2020, what we've tried to do every single year is that we've tried to make the campaign more engaging, find new and interesting ways to capture people's attention, whether it was partnering with Sesame Street to launch some digital games, or launching an A to Z book with authors like Ruskin Bond and Harry Baker, a Guinness World Record for hosting the world's largest online classroom to teach hand hygiene behaviors, to appointing CEOs, which is essentially chief educational officers, young kids who would be championing the cause in their countries. We've tried to keep the momentum behind it. And in a span of 3 years, this campaign particularly has reached about 12 million plus children, via the network of all the countries that Lifebuoy is present in across more than 25 countries. And I'm happy to report that we've seen some amazing achievements, most notable being that we've been able to be successful in advocating getting hand hygiene to be a part of the school curriculum in South Africa, India, Indonesia, Ethiopia, and Sri Lanka. These are some of our top markets globally. And other achievements that we've seen is the sort of PR that it generates, because we have partners who've joined hands with us. So it's not us all alone who's going out trying to create the right awareness and noise and momentum behind it. This year, we're again reimagining H for hand washing by using the power of play as we launch the H for hand washing Play and Learn campaign. As parents around the world encourage their children to engage in daily play, that's something that is undeniably we will want to encourage. We have this unique opportunity to harness this moment and to promote the importance of hand washing with soap at an early age by making it an experience which they love and they enjoy. So what we've tried to do is by integrating hand washing into playtime, we've tried to give it an enjoyable environment where children will learn and practice this crucial habit. How we've drawn on the charm of the world's most popular board games. I'd like to believe we've reimagined or we've hacked them using their universal appeal, and we've been guided by some of the behavior change models that we at Unilever use for our daily work. And in collaboration with Imagimake, a leading toy company in India, we've relooked at some of these board games, and I have it right here with me and I can't wait for it. I'm sorry, it's not very clear, but it's a H for hand washing games, which is designed to make the crucial habit fun and engaging. We've obviously, taken the help of as many experts in this space of play, hygiene, education to come together to help us develop this games kit. Just to give you an idea, like for example, instead of snakes and ladders, it's called germs and ladders, where you have a soap that helps you remove the germs, but the germs come back. With obviously the germs, you come down, and with the ladder, with the help of the soap, you go up. Or the hand washing Ludo, which employs mnemonics to make hand washing steps memorable. Or soap tacto, which uses magnet soaps to remove germs, and the kids can play. Or lose the germs card, where kids learn about what are the germ threat moments. So essentially a lot of engagement, the right tools to get kids involved in it in a manner that it sticks with them, and hopefully throughout their life, it is a behavior that they will never lose sight of. So that's the latest in 2023 coming from Lifebuoy, the H for hand washing campaign.
Thanks, Pranil. And in your opening remarks, you talked about the importance of figuring out how to make hand washing stick. And I think in this, your last few words, you've really given some concrete examples through the gaming and also the advocacy work that went along with it, but to introduce to that early childhood context. So it's a real concrete example of how to make it part of the dialogue and make hand washing stick. Thanks so much. Turning to you, Ben. Again, in your opening remarks, you mentioned, but World Vision is not only an implementing organization, but you've also produced really some important evidence to support best practice in hand washing programming. So could you speak briefly, because I know how deep you go in this, but could you speak on your global research, World Vision's global research and learning agenda, and sort of walk us through some of the key findings developed through your work so far?
Sure, thanks, Julia, and well noted. Not to speak, to speak at the level of the interest of the attendees, not how long I would love to speak about this. Yeah, I think it's a really unique opportunity that World Vision has sitting as an implementing organization. Often people have a particular product or a particular brand, and they're trying to look at ways to increase uptake or something like that. Or there's academics that want to look at something, and it turns out that World Vision has water, sanitation, hygiene programs active in 42 countries. And so if you're looking for ways to test things, there's ongoing programs. And I've really turned a lot towards ideas around this approach of implementation research. So, this doesn't need to be some sort of academic trial that happens, but you can have sales agents going out and they can try a couple of different messages. And with some tweaks to how those are delivered and how those are controlled, you can generate evidence that can inform practice. This isn't maybe the way you want to generate the WHO's next, health impact sort of evidence or anything like that, but in terms of product uptake and behavior change, I think it can be really an easy way to do it. And so our journey on this really looks like one, we looked at some wash business centers that we have operating in a number of countries, but looked at them particularly in Ethiopia, where we saw really low rates of basic hygiene access at household level, and tried to test out what's the combination of marketing or subsidy or some sort of social norms intervention or product introduction that might lead to change. And we didn't find the solution to get from about the 5% that it was to 100% with one silver bullet, but did identify huge gaps in just awareness of even some basic products. And this led us to in a couple of directions. One was trying to think about, okay, how do we actually reach people with marketing messages? As much reach as we have, we pale in comparison to someone like Lifebuoy in terms of pure marketing spend. But what we do have is people active on the ground in communities, and so thinking about ways that existing structures and contexts could be used with community health workers, or approaches like care groups, which are sort of a training of trainers cascading approach. And so in Ghana, evaluated the effectiveness of this sort of light touch but high coverage, high frequency sort of model, and saw in a controlled before and after trial about 50 percentage point increase in basic hygiene access at household level. I will be the first to say that I'm sure that this did not correlate to something sustainable, because we weren't necessarily looking at these like kind of new durable products that are coming out, but it was definitely not nothing. And so trying to think about, okay, how do we link that promotion with product access, things like that. And the last thing I'll say is, increasingly in a related part of the sort of wash sector, when we think about sanitation, it's recognized that it's not just an issue of household investment. It's an issue of governance and finance and people working together, thinking about subsidies and what that might look like. In hand hygiene, the cost structure of this is a little bit different. Hopefully the aspirational hand washing station is not as expensive as the aspirational toilet, or we're all in trouble. But there may be structures where different products, different hand washing stations, for example, might be delivered in a subsidized way that could even be cost effective for people then purchasing soap or hygiene products. And so that sort of cost effectiveness piece, I think, is a really important piece that we're trying to start to look at to understand, how we can most effectively reach these high levels of coverage we're all looking for.
Thanks. And on each one of these subtopics, I think we could have a whole webinar session. I mean, we've been mentioning throughout the role of monitoring, surveillance, and in this case, more rigorous research to try and measure not the inputs and the impact of the various, if you will, the different variables and the key role of enabling technology. You mentioned subsidy, and also clearly the role of the private sector in participating in that. But how do you manage subsidy without ruining markets, which can happen, but that in itself is a huge challenge, and could be another webinar topic we have for ourselves here. I mean, you didn't mention in particular, but might be interesting to this group also, the USAID Wash Pals project that I'm working on is collaborating right now with World Vision in Malawi to specifically look at how to focus in on hand washing at that food hygiene junction. And we found in general, there's so much more emphasis on figuring out how to promote hand washing after defecation, but there's a number of junctures. And so to focus in a bit on the food hygiene and as that relates to infant and child growth. So we'll look forward to sharing some of those findings with this group as they unfold. Shifting back to some more general offerings to this group, and this would be a question for all of you, all of our panelists, but all of you are doing some really critical work to accelerate hand hygiene, and we've seen from various perspectives and entry points. But can you specifically talk about how others might join in on these efforts? And I'll leave that as open mic, whoever would like to jump in first. But how can others join in on some of these efforts?
You might be too polite, Julia.
Then I'll say, while your mic is open, please, Joe.
Okay, well, I'll have a go. I've got a couple of things that occur to me specifically when it comes to WHO and UNICEF's upcoming guidelines, which is what I've been speaking about here today. Like I was saying, really for us to develop these recommendations, these global recommendations, and for them to be globally applicable and for them to be implementable and to be relevant to people who are working on hand hygiene on the ground, we really want to bring the best skills, science and evidence to inform these processes. So please document the work that you're doing at whatever level, in whatever guise. Please can always make sure that the work that you're doing is documented so that when outfits such as ours go out to retrieve and synthesize evidence and experiences, we come up trumps and we can really do a good job of that synthesis and start to reflect that much better in global guidance. So that's the first thing. And just to flag, you'll hear about the Hand Hygiene Acceleration Framework tool in the next panel, but that's one of many tools that you might use to document what's happening in your country and how your government, for example, with the HAV specifically at the national level, is approaching this system strengthening and sort of making hand hygiene a strong policy issue. So that's a bid for documenting. And the second one is, I suppose, to join the conversation. And we're very privileged to be partnering with the Global Handwashing Partnership for the development of the WHO and UNICEF guidelines, in particular, enabling us to have broader reach in our consultation. So there will be a number of consultative workshops coming up in the pipeline, trying to engage different communities of practice on the guidelines. Because what we don't want is to produce another weighty document that's cluttering our shelves without clear direction on how to implement. We want to produce clear implementation guidance that is context specific and tailored to different user groups. And we can only do that by hearing how users perceive the guidelines and how they might implement them. So that's the second bid, is to stay tuned and please do join us so that you can be part of the conversation. Back to you, Julie. Thanks.
Thanks for that. And certainly we have a list of participants here for easy reach out when you're ready for that kind of input. We could engage a coalition of the willing from the group right here. So much. Ben, do you want to jump in?
Sure, I was going to say I'll go second just to mix up the order a bit for everyone.
Exactly. You can see what I'm doing.
Yeah. No, so I think sort of building on what Joe said, World Vision, I'm sure most people's perception is this sort of global organization, and I even mentioned present X number of countries sort of thing. But I think in terms of the way we think, our country offices are very much the ones that are leading the way. I have the privilege of being on this panel this morning, but I'm very unimportant in the scale of what's happening in our countries. And I think more to the point, the way World Vision is arranged in countries is that they're less concentrated in sort of like national policy making circles, and they're more concentrated intensely at sub-district area, and so link with district level governments to show, okay, this is what can happen in this area. And I use that to say that I think, the idea of partnership is great. And I think even beyond just the sort of global partnership, thinking at country level, it's much more time intensive and more work, but it's really where we see the sort of change in our work. And so thinking through where where someone like World Vision can work with other implementers who have more sort of national level policy or sort of national level hygiene campaign credentials, working and interfacing with folks like WHO and these guidelines to advocate with national governments, and then to actually work with district governments to see how we can operationalize these and build evidence that they can be successful. And then work with private sector as well. We're not product innovators, we're not experts in import export or anything like that, but we can and have worked in a number of places to see where our intensive community activation work can really make the ground fertile for appropriate products to come in. And so I think putting in the time and effort, as hard as it is to do that work, I think that's where we really see the changes at that sort of national and even subnational levels through partnerships.
Thanks for that plug again for coordinated partnership and the essential role of measuring, seeing some themes, resident themes come out from all of you. Parnell, we'll turn to you now. What would you offer the group as far as some concrete ways to join in on the efforts?
I'm going to take a cue from Joe and stick to the theme that I've spoken about today, which is around engaging behavior change content on hand hygiene. And for over a decade, like I said, we worked with experts to create this kind of material, which is proven and tested. And actually, a lot of this material is available publicly on the Lifebuoy Global website, and in fact, through this Global Hand Washing Partnerships page. So I encourage, and I'm very happy for partners to use this material to reach as many people as possible. And I think secondly, in our quest for to make it stand for hand washing, we've been trying to work across geographies to advocate the importance of including hand hygiene as part of school curriculum. So if there are any interesting thoughts, ideas, or anyone wants to join us on this, on how this can be universally achieved, we'd be very happy to partner. So yeah, those two.
Excellent, thank you. Thanks so much. Unfortunately, we are unable to unmute participants to get more active question and conversation, but please in the chat and do ask or make any comments that you might have, and please know that we'd like to be a bit more engaging, but our technology is not quite allowing that. So I want to give a big thank you to our panelists, really to highlight, I think, a big range of variety of global level hand hygiene efforts, including some ways that participants can plug in. So we're going to advance now in our program, our Global Hand Washing Day programming, and look at a video that's highlighting what some other global leaders are doing to commit to hand hygiene. So with that, thanks so much to our participants, and we'll turn to the video.
Hand hygiene is an essential component for health and development, from disease prevention and nutrition to education to preventing future outbreaks. FHI 360 serves as the host of the Global Hand Washing Partnership, working with over 40 partners worldwide. Through this partnership, FHI 360 remains committed to achieving hand hygiene progress.
At the Sanitation and Hygiene Fund, we're seeking out transformative solutions in hand hygiene to expedite progress in this neglected area of wash. Hygiene is a cornerstone of well-being, and we believe that market-based solutions are the way to achieve scale, making hand washing accessible and affordable for all. We encourage everyone, including investors, to look at hand washing in terms of impact, both social and financial. I wish everybody a very happy Hand Washing Day.
WaterAid is committed to this work over the last 3 years in all 26 countries that we work in. We've been delivering innovative hand hygiene behaviour change, working with government programmes, and we've reached 240 million people with hygiene campaigns focused around the response to COVID-19. And finally, we're delighted that in the region of SADC, with all 16 country members, a hygiene strategy has been developed again, with our input. So we're continuing to prioritise this vital work. It's absolutely key to delivering SDG 6.
Well, thank you to those leaders for discussing the commitments that they've had for hand hygiene, for what's been done and how they're moving forward. Such important work by them, and thank you to our panelists. You know, in our global panel, one of the things that I heard from more than one of the panelists, really everybody, is we need to look forward with different approaches so that we're effective in achieving the goals for hand hygiene. We can't do what was done 10 years ago, 20 years ago, or 30 years ago. We need to move forward with better approaches. So thank you so much for those words from our global panel. And as you heard from our global panel, they went right down to the country level and even the district level, because that's really you know, where the work gets done. And that's the subject of our next panel, is looking at what can happen with country leadership for hand hygiene. And to lead this panel, I'll introduce our colleague, Nat Painter, who's a senior sanitation and hygiene consultant with UNICEF in New York. Nat, looking forward to hearing everybody's responses on this panel.
Terrific. Thank you, Ron, and thanks for the introduction. It's a pleasure to be here observing this pre-Global Hand Washing Day celebration with so many around the world. As Ron mentioned, I'm Nat Painter, and I work for UNICEF on hand hygiene from the New York office. And I'm excited to talk about the Hand Hygiene Acceleration Framework tool, the HAFT, as it's proving to be an effective tool in helping countries focus their efforts on advancing hand hygiene. I'll give a brief overview of the tool for those who are unfamiliar or who need a refresher before going into the global findings. And then after my brief presentation, we'll have a chance to talk with two country representatives about their national programs. Dr. Susan Al-Zubaidi, the Director of Health Promotion from the Iraq Ministry of Health, as well as Mr. Ian Salaru, First Deputy Director from the National Center of Public Health at the Moldova Ministry. So just a background on the HAFT. The HAFT was developed by UNICEF, WHO, and WaterAid, and it follows a Hand Hygiene for All call in June 2020 for governments to accelerate universal hand hygiene, both the access and behavior change. The tool, it was designed to both track the process a government has undergone to develop and implement a plan of action for hand hygiene, and to assess the quality of that plan. So here you see on the icon on the right, the outer ring represents the tracker, monitoring the process, while the inner ring represents the assessment. And I know it looks complicated, but we'll break it down in a moment. This really helps identify the barriers and opportunities and priority actions for accelerating progress towards universal hand hygiene. And the tools intended to be used by national and subnational governments, development agencies, NGOs, CBOs, and the private sector, really the whole system in a room. And ideally, the HAFT the completion of the HAFT would be led by a lead government agency, which is often the Ministry of Health, implemented in consultation with the NGOs, CBOs, and the development agencies. So let me take a minute to break this down, because I know the iconography is a little complicated. So taking the outer ring, the tracker, and as I mentioned, this is designed to help countries assess progress in developing and implementing a plan of action. And the tracker looks at 5 process milestones and asks participants to self-assess where the sector stands within their country, within their state, whatever geography that they're assessing. Each milestone has several indicators which are assessed on a 4-point scale. These are from 0, no progress or barriers, to 1, some progress but off track, 2, good progress and on track, or 3, to we've completed this area or we're maintaining it going forward. So the process starts on the upper left with preparing for action, really trying to understand, are we as a sector in a position to start moving forward on hand hygiene? Then analyzing the situation, prioritizing the actions, executing plans, and finally monitoring, evaluating, and adjusting. The idea, however, is that the tracker, it really needs to be undertaken at regular intervals so that we're able to mark progress and really see how interventions are impacting the development of the sector. And so you see that with the arrows that the cycle continues. Moving on to the inner ring around the enabling environment assessment. And this is really designed to help a country assess the quality of the national hand hygiene roadmaps and action plans, policies, or programs to see if they're strong and in a position to really make progress towards achieving universal access to basic hand hygiene. It helps provide direction on how to best prioritize interventions. And it also looks at 5 pillars. And these are aligned around the UN Waters Global Acceleration Framework and include governance, finance, innovation, capacity development, and data and innovation. As with the tracker, these pillars are self-assessed against indicators on the same 4-point scale of no progress, some progress but off track, good progress, and have we completed it or maintaining. So this is somewhat abstract. So let me give you an example of how this might work in practice. What we have here is a sample of country X completing the assessment portion. And you'll see in this, on the left, we have on the top, we have the numbered assessment, and then below it, a radar diagram showing where the country stands against each of these pillars. And you'll see that they have self-assessed themselves as reaching certain progress. And overall, you see that the country has made good progress on data and information and innovation, but governance is ranking low. And overall, it is scored a 0.88 as country progress. If we go a year or so later at some subsequent assessment, you see that they've made significant progress. Governance has dramatically improved, as has financing. However, innovation has backslid. We know that these developments are not necessarily a linear progression forward. There might be forward and backward movement. And this is going to warrant a closer look as to what's driving it. And you'll see with the overlay of the second year's progress that the country is now averaging 2.07, and the radar diagram reflects that improvement. And now looking out to the final year, all the pillars have been achieved, and the country should be in a strong position to achieve universal sustainable access to basic hand hygiene. The country has now achieved a 3, and the radar diagram at the outer ring is complete. So what is the HAFT telling us at the global level? So the HAFT has been completed by 20 countries so far, from island nations like Vanuatu to large countries like Nigeria, as well as subnational governments like Odisha and India. You'll see on the left that the gradations of scoring are from 0 to 3. And on the map, you'll be able to see the participating countries and their average score as represented by the coloring. So what's the main takeaway? Well, given this variety of countries, there is, unsurprisingly, a tremendous variability among countries, but I've tried to capture some of the main takeaways here. Overall, within this data set, the global average is about 1.07. So we're making some progress. COVID-19, as we mentioned earlier, was a significant driver of strengthening hand hygiene policies, coordination, capacity building, et cetera. And there has been a strong integration of hand hygiene into healthcare facilities, but it's really been limited into other sectors such as education or transportation or public spaces. What was interesting is that we found that countries reporting multiple stakeholders involved in the hand hygiene report generally reported greater progress on financing. And this perhaps reflects the leveraging of budgets from multiple sectors. And similarly, by leveraging existing definitions, indicators such as a JMP, this often corresponds to a higher monitoring evaluation progress. And then finally, where the real opportunity here is that it seems that the private sector engagement on hand hygiene at the national level has been largely untapped. We've heard some discussion about that earlier with Unilever, but I think there's a lot of opportunity to move forward with this at the national scale across the participating countries. So I just wanted to drill down a little bit into some countries to show some of the nuance. So taking Belize, very interestingly, Belize has a relatively low half score of 0.8, but greater than 90% access to basic hand hygiene. Be really important to understand what's driving this overall success on hand hygiene. It's integrated hand hygiene into multiple sectors, but however, there is so far no national hand hygiene specific policy. Given the high level of coverage, perhaps a national hand hygiene policy isn't necessary, or perhaps there's an area that needs to be explored more so on that front. We'll be talking and learning more about Moldova in a minute, but Moldova has a half score of 1.36 and 87% access to basic hand hygiene. Again, quite high across the countries surveyed. There's been inclusion of hand hygiene in national programs and protocols, but there still seems to be a need for financing and stronger coordination, and well, it'll be interesting to dig deeper into that item. Finally, looking at Iraq, which has a half score of 1.62, but even greater than 97% access to basic hand hygiene, a remarkable achievement. Very strong governments reported in the Haft, but at the moment there's still some implementation is being hampered as they await budget approval. So I'm really happy to announce that the Haft, including country and state results, will be launched as a digital website on Global Handwashing Day. There's a link to it on this page, but also be dropped into the chat. It will contain the global summary, country level summaries, as well as a link to the actual tool. And so, yes, you can connect to it via the link in the chat. And this should go live on a Global Handwashing Day itself on October 15th. So thank you for your time and this brief overview. And now I'd like to bring on our panelists. So as I mentioned earlier, this includes Dr. Susan Al-Zubaidi, the Director of Health Promotion at the Iraq Ministry of Health, and Mr. Ian Solaru, First Deputy Director at the National Center for Public Health in Moldova. So thank you both for joining us. And would like to get straight into the conversation. And maybe Mr. Solaru, starting off with you, just for people who are not familiar with the Moldovan hand hygiene sector, could you take a minute to brief us on the context and where the sector stands currently?
Thank you, Nat, and hello to everyone. Republic of Moldova is a small country in southeastern Europe. And hand hygiene is an important public health issue. It's considered a priority for health promotion and in communicable disease prevention. Yes, as you mentioned, in the Republic of Moldova, we don't have a standalone hand hygiene policy, but this topic is on public health agenda and is promoted in different policy documents. As you already mentioned, is National Program for Implementation of the Protocol on Water and Health, which is a specific European binding document. And Republic of Moldova, it's a part to the protocol. And also recently was adopted National Health Strategy for 2030. It's European agenda in Republic of Moldova, so we intend to join to European Union till 2030. And also there we set some targets, including in health. Yes, we have a good evaluation of situation. We carried different surveys, especially wash in schools and wash in kindergartens. And also we carried mixed survey, and last survey is from 2016. You already mentioned we have quite higher, and we consider this is realistic, not over-evaluated situation. We know where are our gaps and problems. So we consider that access to hand hygiene is impossible without safely access to water and sanitation. So we are focusing also our activities on increasing access, the general access of the population to water and sanitation. And for sure, we also have an increased awareness of the population for hand hygiene during COVID pandemic. And another, let's say, important reality in Republic of Moldova are refugees from Ukraine after the Russian aggression in Ukraine from 24th of February last year. So we are focusing also on offering good conditions for hygiene in general, for hand hygiene in refugees camps, in all areas where are located refugees. And yes, we have to mention that we have to enlarge this topic. This is as usual, a part of school curricula in educational settings and also in healthcare facilities. But we have to work harder to extend it to other facilities. Thank you.
Thank you, Dr. Solariu. I appreciate that response. And unfortunately, Dr. Al-Zubaidi is having some challenge with her audio, so we're going to keep talking. And so,
okay, so if I can continue, I can continue.
Great. Well, I have a question in response to what you were saying. One area that I was interested in, as you mentioned, the lack of a standalone policy. Do you think it's necessary to have a hand hygiene policy, or given all the progress that you're reporting, through strong coordination, that can be addressed outside of a policy environment?
Yeah, you know, it's a question of tradition of countries to not only to adopt but also to implement policies. So you can develop as much policies as possible, but without strong implementation, without strong enforcement. I think it's important to set this as a priority. And you know, we also after this exercise learned some lessons. We start preparation for next program on protocol on water and health implementation, and which this preparation will end next year with proposing the next national program, and we intend to set targets on hand hygiene. If for now we have covered only educational settings and healthcare facilities, we will enlarge to all kinds of facilities. And also other topic is to build capacities, to have capacities not only in health sectors, but is very important to have it in educational sector. And this year, with some support, we reassess school curricula for health education. And also we developed an addendum for school curricula with guidance of new emerging health topics. And one of them is water, sanitation and hygiene, where we provide quite detailed recommendations for school children and for school staff on how to follow individual hygiene, specifically on hand hygiene. So we already also made some conclusions about after this exercise and start to use hand hygiene acceleration framework tool.
That's terrific. Yeah, it's really exciting to hear all the progress that are going forward in Moldova. One follow-up question that I had is you talking about expanding the role of hand hygiene in other sectors. You mentioned healthcare facilities and then also schools, but then you were mentioning expanding into other areas as well. And that kind of work implies to me strong coordination among the different ministries and agencies. And maybe that has been highlighted as a challenge with the opening remarks. How is Moldova handling that?
Yeah, it's a good question. So we continue to use for that as a coordination mechanism, steering committee, which we have in charge on policy dialogue, or mainly on water policy dialogue, which is concomitantly a steering committee for the national program for protocol implementation. We consider that is better than nothing. There we have on board the Ministry of Health, Ministry of Environment, Ministry of Regional Development, and also Ministry of Economy, Ministry of Finance, and Ministry of Education. Yes, we need more involvement of other sectors, such as Ministry of Labor. For example, we want to promote hand hygiene at working places. And already we developed a curricula on health promotion for working places. Other target for us are residential settings, such as all social institutions, social settings. But the main challenge for us are public places. So how to create conditions and how to increase awareness for the population, to encourage population to request from local public authorities and to have conditions for hand hygiene in public places. So this is our main challenge now, for what we started in September, a national communication campaign, which is carried by Medical University. So Medical University of Moldova is coordinating. It's let's say an implementation agency of this campaign. This campaign is supported by National Health Insurance Fund. It's for the first time when they agreed to support such kind of communication campaign. We're at the stage of developing informational products such as video spots, flyers, banners, and this is first campaign in hand hygiene, and we also intend to learn something from this campaign to have a better planning for the next campaign. And also we intend to start an aggressive communication with local public authorities after local elections, which we will take place in Moldova in November. We consider that till that is can be waste of resources. We will start after that, so to work with new or old local public authorities on this topic, focusing to have hygiene conditions in public places, including public transport, also in other areas like as squares, place of public health meetings or health or public meetings, will better to say. So these are our plan, and in the same time challenges how to further proceed with this issue.
That's very exciting. Your plans are very exciting. And I would say that your plans sound expensive. Can you talk a bit about the financing that you would anticipate for this? Because that's consistently come up as such a barrier around hand hygiene. Do you anticipate having enough resources?
You know, being a low middle income country always is a challenge to have enough money, because Minister of Finance, at any request, they will answer that not enough money. We have a lot of emerging priorities, but for us as public health, we should be insistent and to follow, to ask again for financing. Yes, for sure, this area is underfinanced, and we know that at national level, also at public health, at the local level, excepting some big our municipalities, always they have enough. They don't have enough money. They have problems with money. What we obtained during last years is that now, for the first time, in the budget of educational settings and health facilities, they have a special line for soap to have there, for disinfectants, because for healthcare facilities is also an important issue, but also is important to have money for increasing capacities, for training for their staffs. I mean, for teachers and for health workers. So we have some, we consider partial success with these settings, because we focus more attention on these settings, and we will start to move this to solve this issue also with local public administration, because always the most challenge is there within the communities. We start now in 7 pilot regions to work with NGOs, and we want to move for communities to have better understanding that a lot depends on them, a lot depends on their involvement, and this is not just traditional recommendation to wash hands. It's a banal recommendation, but this is not only can save life, can prevent disease, but this is also a modern trend. So we want to convince them this is in line with healthy lifestyle. So you cannot have a healthy lifestyle without hand washing.
Yeah.
So
sorry, Dr.
yes,
Solowski.
instead of all challenges and difficulties, we are optimistic that we will obtain more financing, and we
Okay.
want to diverse financing sources, as you mentioned in your presentation about our country profile on hand hygiene. Yes, we don't explore till now, such as sources, private sector, as private financing. And we intend to work on that. We will start to convince especially medical or companies which are selling medical equipment for labs, for medical institutions, for school, and we want to convince them that is very good investment in hygiene, in health, in hand hygiene.
Doctor, oh, great, and thank you for that. It seems that Dr. El-Zubaidi has been able to join us, so wanted to bring her into the conversation. Thank you, Dr. Salaru, for that response around the financing. I think that's very interesting for many people involved. Dr. El-Zubaidi, if you're able to connect, maybe you could give us a brief summary about hand hygiene in Iraq.
Good evening, everyone. I'm very glad to be with you in this webinar about the hand hygiene global day. I'm sorry for delaying. Something went wrong with my device. I'm Dr. Suzanne El-Zubaidi, family physician, head of health promotion department in public health in Iraq health ministry. About the hand hygiene, as you all know, Iraq is a Muslim country. As part of our basic source of cleaning and sanitation in our society, we use water. So this is one of the helping tools for us to be more convincing in applying and implementing the
I'm sorry, doctor, I think we're losing the connection. I'm sorry, Dr. El-Zubaidi, I think we've lost the link.
hygiene in our society.
We can hear you now.
You can hear me?
It's breaking up a little bit. Can you continue speaking?
Hi, everyone.
Yes, we can hear you now.
You are hearing me now? For the question you asked, I started about the water and our usage in our country for sanitation and cleaning. This helped us to apply and implement the hand hygiene planning or policies in our country. In addition to the occurrence of COVID-19 pandemics, which made it more necessary to use, in addition to water, the sanitation liquids and alcohol for more hand hygiene, wearing gloves. This helped us more to get more behavioral changes in be on the hygiene. You are hearing me?
I'm sorry, I'm afraid it's breaking in and out again.
Sorry, can you hear me?
Yes, now I hear you clearly.
Okay. Shall I start from the beginning again, or
No.
what?
No, thank you. You were explaining how, as a Muslim country, it assists in the practice of hand hygiene, and that's helped drive the behavior.
To the COVID-19 events, you know, 19 events, which made using of the sanitary liquids and alcohol.
Yes, yeah, exactly. The COVID was driving the
You are
practice
hearing
as
me
well.
now? Sorry.
Yes,
This made the hand hygiene more to be emphasized more in our countries and make it more easy for us to convince population about their behavioral change towards this maneuver.
Yes.
You know, in our country, we have many ministries, Ministry of Health and Ministry of Environment. Those both ministries are responsible for such a strategy or a policy because the Ministry of Health responsible for behavioral change and the health education awareness for the population, where the Ministry of Environment is responsible for water sources availability and sanitation in our country. The challenges for this subject, sometimes in coordination between the ministries may occur, which makes the policy achievement some sort of difficult. Sometimes the loss or lack of good infrastructure may be also another challenging. The availability of the financing also may be one of the challenging, and the emphasis on other sectors and so on. Can you hear me?
Yes. No, I heard that well. Thank
Okay.
you. No, I appreciate
You're
that. And I'm afraid we're coming to time, but I'm very glad we got to have Dr. Al-Zubaidi have a chance to talk
You
a bit
are
about
welcomed. You are welcomed at any time. I'm very sorry for these technical errors which made me to be late.
That's quite okay. And this is the time that we live in, where technical errors are a part of our life now. But really appreciate your patience and sticking through with it. And Dr. Solaro, many thanks also for your information about Moldova. I thought
Very glad to participate.
I thank you. And I thought the interesting takeaways I saw there were around the importance of coordination and the opportunities that presents as you work closely across sectors, both in Moldova and, as Dr. Al-Zubaidi was mentioning, in Iraq, and as well as the links to the infrastructure that accompanies it, the focus on water supply. I think I heard that from both countries as well. So thank you for this discussion. And I consider it the first of hopefully many more discussions because there's, I think, a lot we can learn from both your countries. So thank you for your time.
Thank you for your.
And I'm going to pass it back to Ron to take us forward. Back to you, Ron.
Well, thank you. Thank you to our honored panelists for sharing with us the work that you're doing in your countries. And thank you for Nat for moderating that. You know, the theme for Global Handwashing Day this year is clean hands are within reach. We know that means something different for everybody. But in our last panel, we just saw that at the whole country level, that means everybody working together, not just one ministry, not just the Ministry of Health, but reaching into the other ministries and even the ministry responsible for commerce to ensure that hand washing is possible in every workplace. And that's the challenge, really, is that for every individual, hand washing is possible because it is a different challenge for each of us. But it is a challenge for each of us, even for people who live in countries where there's all of the facilities available. It's still a practice that to wash your hands at all the appropriate times it is a challenge, but we certainly know that for some individuals, just having the materials, the soap and the water in the sink is a huge challenge. But by all of our government ministries working together, by all of our organizations working together, we're able to make it where clean hands are within reach. But it comes down to the individual level and what individuals do. And that's the subject of our next segment here. As certainly an exciting time to talk about what individuals can do to support hand hygiene. And we'll move forward with that.
At the Global Handwashing Partnership, we work to ensure hand hygiene is universally recognized, promoted, and practiced. To do so, hand hygiene efforts must trickle down from global entities to national governments, all the way down to individuals.
Yeah, so practicing proper hand hygiene can break bad habits, stop the spread of infection, and ensure a better world for all of us. We all have a role to play to ensure clean hands are within reach, from global leaders to the next generation.
Take the lead and get your friends involved in your hand hygiene efforts. Watch us as Nelly from Zambia gets her friends involved in her Hand Washing Day video.
Hi everyone, my name is Esnedi Hamosa Louis, and today we're celebrating the Hand Washing Day. As am I going to wash my hands? You can start. You can give me the hand wash. Wow, as you can see, my hands are so clean. I hope you at home are doing the same, because it helps us to maintain a good and better environment. As you can see, I've involved my friends and they're going to wash their hands. Wow, I'm just in love with this. I'm so happy. Washing hands is good. We have to keep those germs off. Yeah, we have to clean our hands so that we can kill 99.9 germs. So washing hands is very important, guys. As you can see, my hands are sparkling clean. Wow, we have done all our best, and together we say Hand Washing Day! Bye!
Yeah, it's great to see creativity in hygiene promotion. As a musician myself, I'm always thinking of how we can make a catchy hook for a song. So Mia from the Philippines wrote the song to spread the message at her school.
How's your hands? Is it clean or dirty, dirty again? Free from germs. Wash your hands with this soap. Soap your hands, cover on its surface. Rub and scrub palm to palm. Palm over dorsal. Rinse and dry your hands. Touch your face already. How's your hands? Is it clean or dirty, dirty again? Free from germs. Wash your hands with this soap. Free from germs. Wash your hands with this soap. Free from germs. Wash your hands with this soap.
No matter what you do, the most important thing is to take action for clean hands. As you've heard today, there's progress being made at all levels.
Yeah, but it's up to us in our everyday lives to practice good hand washing and to promote hand hygiene beyond global hand washing.
Well, certainly an inspiration to see what some individuals are doing to promote good, clean hands, and inspiration for all of us to see how we can bring new enthusiasm and new innovation, new creativity to our individual efforts. I'm happy to have Ann Thomas, who's a senior advisor for sanitation and hygiene with UNICEF, here to provide some remarks about what's been discussed today. Ann, over to you.
Great, thanks so much, Ron, and thank you to all the participants and speakers today for such a compelling celebration of Global Hand Washing Day 2023. I wanted to also especially thank the Global Hand Washing Partnership for pulling this together and hosting this event. I wanted to take a minute just to reflect on the fact that this is the 5th 15th Global Hand Washing Day that we are celebrating as a global community. The first one being held in 2008. And I think a lot of us on the call were there from the beginning. And there's been a lot happening during that time, and a very interesting evolution from that first Global Hand Washing Day to where we are now. And at the same time, we saw that between 2012 and 2022, we had a 30% increase in the people with access to basic hand washing facilities. So that was about 1.4 billion that gained access during that time. And so I wanted to give a little bit of a behind the scenes of the sort of tactics and tactical evolution of the agenda on Global Hand Washing Day and the global hand washing community that we all partner with. Behind the scenes, leading to some of those achievements, but also to the focus of the discussion today. So in the first year, we had a very big focus on celebrations. We had, a lot of countries, over 100 countries were celebrating. We then turned our focus to data and making sure that we had hand washing indicators in the mix in DHS surveys. We had a number of epidemics where we started learning a lot more about behavior change and the short-lived nature of fear-based behavior change, for example, but then we started learning about the universal motivators of behavior. And so we started infusing our programs with more state-of-the-art learnings from our academic colleagues and partners who were implementing state-of-the-art programming, as well as our private sector partners on what works for behavior change. And we heard about how that's an evolving agenda even today. We also learned about how countries started looking at accountabilities and how do we do this properly at country level. During COVID, we saw for the first time that hand hygiene was in the public policy realm, and countries wanted to know how to do this, how to make sure that hand washing wasn't something that only came up during an epidemic, but that stuck over the long term. And so that generational opportunity is really what we're building on now today in our celebration. How do we really get our attention on hand washing ingrained in public policy, into best practice, into institutional accountabilities that can drive effective programming that's not reactive, but is actually preparing us for future pandemics and future health crises, but also ensuring basic health, a frontline health intervention for the poorest communities. So it was really heartening to hear about all the progress made in countries. It was great to hear from Moldova and Iraq talking about how, it's not just about the policy environment, it's about how we implement this. So it's good to see countries moving forward on the coordination arrangements, the financing arrangements that really drive implementation of this progress. And I was also inspired and heartened as usual to hear about the efforts of the global community in pushing forward on more behavior change initiatives and research, looking at how do we provide good guidance to governments to support scaling up of hand washing programs and sustainability of these programs. UNICEF is proud to be a global, national, and subnational partner with hand hygiene partners around the world, and our partnerships with governments, donors, NGOs, private sector, and academia are helping to advance some of the critical areas of hand washing promotion that we are so interested to achieve. So I wanted to thank you all for your time today, and I wanted to pass back to Ron for his closing remarks. Over to you, Ron. Thanks.
And thank you so much. That was a great summary of today's event. Once again, my name's Ron Klemmer. I'm with the Global Hand Washing Partnership. I want to thank all of our partners who made today's event possible. I want to thank all of our partners for making Global Hand Washing Day possible. And it's again, it's another great day this year. But it's a reminder that we all have to work together to make sure that clean hands are within reach for everyone. And part of that is taking new approaches and new creativity. And with that, we'll just sign off with a song that was made by one of our partners to celebrate hand washing. Thank you, everyone. Have a great Global Hand Washing Day.
Dance. for wash. Introducing Viva con Agua. Shake it, make it, wash it, break the cycle, break it. All around the world, Africa stand up, wash it. Zambia, Malawi, Rwanda, shake it. Tanzania, Mozambique, break it. Upewa kuma posa kujiza. Hey yo, dance buga, beating on that drum like a barracuda. If you know how to flow like water, get on the dance floor, show me how to dance, muna. Come and represent your crew. It doesn't matter where you come from, do what you do. After food, chill out, bro, bust the move. All about a clean life like the waters do. Hey, energy, energy, ECA, and we all about energy. Yeah, 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 yeah. If you thirsty, we bring you the water. Drink up, break it. Upewa kuma mosa kujiza. Samba muliko, como muliko, samba manj. Como muliko, viva con agua.
Sir, East verse in the essay, Mozambique in the essay, flesh and clean I tweeted, Ukuti kufi like a flesh. Bear was a changes, tree was a culture, changes. Tiku choka mundende ya umve you follow the teacher me sense. Iwe janja, sanga chola bacha, ugata samba manja de package moyo jinzanga. Iwe janja, sanga chola bacha, ugata samba manja de package moyo jinzanga.